For patients with vision loss, getting to and through a medical appointment isn't always simple. We asked a few patients to share what that experience was like and what changed.
What was most difficult about getting to and through your appointments before you had support?
Well, I certainly will say I've been coming for at least 3 years now to the clinic, and in the beginning, it was difficult. Navigating, trying to figure out which clinic to go to, because this is not the only clinic in the Wilmer Institute. So it was difficult for me to figure out, which way to go, how to check in, the check-in process.
Before Heather became the administrative assistant, what we'd have to do is wait in line to get in, which was okay, try to get an appointment. It became very cumbersome.
I just came and I just followed the directions that somebody told me to go here, go there, go where.
What difference did having that kind of support make, including help with scheduling and coordination?
And with Heather, kind of handling our requirements as far as rescheduling, it's been like night and day. And I mean that very sincerely.
So I kept it simple.
Definitely made the anxiety level go down, and it helped the continuity of my care again because I was able to be consistent in getting my eye injections.
Some patients also received wheelchair and escort support to help them safely get to and through their appointments.
Can you talk about how the wheelchair or mobility support helped you during your visit?
Yes, using the wheelchair did make it a whole lot easier and more comfortable. Heather was taking me where I needed to go from place to place, and I didn't have to think about it, so that made it really, really easy.
The wheelchair service definitely helped me feel safe. It made me feel secure and cared for.
Some patients had difficulty reading and managing their medications at home and were connected with support to use the ScriptTalk device.
Can you share how the ScriptTalk device has helped you manage your medications at home?
Well, the most important thing about ScriptTalk for us was the fact that my wife has serious low vision. She utilized what was being said to identify what the prescription is, how many times per day that you were take it. It was an excellent product. We still use it today.
Beyond logistics, patients also described how this support affected their experience.
How did having that kind of support make you feel during your care?
Well, I felt more comfortable coming in because I did have that support. I certainly would recommend anybody who needed what I need that they come down here and see the doctors and Heather and everybody because it's comfortable that way.
Having Heather to intervene right there and say, you know what, let me check the schedule to see if we can get you in a little sooner, definitely made the anxiety level go down, and it helped the continuity of my care.
With Heather, when we walk out, we already know what the appointment date is. It's been an excellent experience.
Looking back, patients shared what they would want others in a similar situation to know.
Can you share what would you want someone else in a similar situation to know?
Your care can become mundane and you just say, I don't feel like it, but it really felt like Heather is here for me.
If someone brought it to my attention that they're having vision issues, but they don't have a particular doctor that they'd like to go and see, my recommendation with 100% honesty would be you should consider Dr. Peter Gehlbach.
I mean, it's not comfortable getting the shot, but it's comfortable knowing that you're being treated so well. I always tell people I get treated really, really well down here.
For these patients, support meant more than getting to an appointment. It meant feeling safe, supported, and able to access care with confidence.